Hi guys, in today's video I'm going to show you the easiest exercise that you can do for treating your low back pain that you can do anywhere. I'm Sam Schroetke, Doctor of Physical Therapy at Physical Therapy and Hand Clinic of Hillsborough, and in this video I'm going to show you hands down the most convenient exercise for treating that stubborn low back pain or sciatica. That means pain running down the back of your leg. I've even seen this one work for people who thought they had hip bursitis. That means the pain that's kind of residing in here. I've even seen it work for that. This is called extension and standing, and that's why it's so convenient, because you can do it anywhere. You can do it while you're waiting for your flight. Heck, you can even do it while you're on the airplane. You can do it at work. I've seen delivery drivers do this where in between unloading and loading the truck, they can do 10 to 15, and it helps keep that pain at bay. It doesn't bother them. They can still do their job. Extension and standing. What it looks like is you're going to, ideally, you have your hands on the small of your back. If it hurts your shoulder, if you have shoulder pain on one side, then just do it with one arm, the one arm that's not hurting. But ideally, you've got both. And you allow your hips to roll forward, and then you arch your back as far as you can. Hold 1 to 2 seconds, and then back. Hips roll forward, arch the back as far as you can, farther, farther. Hold 1 to 2 seconds, and back. And you're going to repeat that 10 to 15 times in a rhythmical fashion. There. Hips roll forward. There. And this is an end range technique, end range loading technique. So it's very important that you're getting your back, the joints of your back, to move as far as you can into extension. End range is where the magic happens. When you're able to do that, it's like resetting everything. It's like hitting Control, Alt, and Delete for your nervous system. So as you move farther and farther into your range, your pain improves. If you're having symptoms into the leg, that should improve. And you're moving more full and freer with everything, not just with this exercise, but with everything, with walking around even. Okay, it's very important that we get to end range. This is an extension exercise, so we're going backward. And I think the reason extension tends to be most effective for most people with low back pain is because we spend so much time in flexion, so sitting, and because we flex so much, picking things off of the floor, whatever it is. There were some researchers who followed people around, and they counted that people were flexing their spines, including sitting, over 4,000 times a day. Picking up my shoes, putting on my shoes, sitting at work, 8 hours. That's a lot of movement into that direction, okay? So all we're doing is taking this and going into the opposite direction, and it's a very powerful exercise. And this is the most convenient one because you can do it anywhere. That being said, the best exercise for most people with low back pain tends to be extension and lying. I'm going to put the link to the video, but that's where the one where you lie on the mat and kind of like you're doing that prone cobra exercise. That tends to be more effective for more people because of gravity pushing on your back, and it really helps you get those joints to end range. But that's not convenient to do everywhere. You can't just drop down on the middle of the warehouse floor at work and start doing 10 of them. You can't just drop down on the flight. And well, you probably could, but you might not want to, okay? So this is a great one to supplement that exercise. If you do extension and standing, and it gets rid of your symptoms, perfect. No need to do extension and lying. But for most people, that'll help keep their symptoms at bay, but it's not necessarily fully fixing the problem or getting rid of the pain, and they have to do extension and lying. But again, this is a great supplemental exercise. One other note with extension and standing is keep your knees relatively straight. What some people will do is as if they're doing a limbo contest, and they'll bend their knees and then kind of lean backward. It kind of gives that illusion that I'm really going back far here. But if I stand upright, see, I'm actually not that far. That's what I've got left in me, okay? So again, knees relatively straight, hips roll forward, arch that back as far as you can, and you're going to do 10 to 15 reps every 2 to 3 hours, and it's generic to say every 2 to 3 hours. Some people's symptoms are such that they do 10 to 15 reps and the pain maybe comes back in an hour and a half. If that's the case, you're going to want to do these 10 to 15 reps every hour. And as you do them consistently, that window is going to become longer and longer and longer until you get to the point where you might not even have to do it daily. Although I still recommend doing it daily because we do flex so much, okay? If you do 10 reps and you're pain-free for 2 hours, but the pain starts creeping up around the 2.5 hour mark, I would do 10 to 15 reps every 2 hours. You've probably heard before when people have had a surgery and the doctors will come in and say, take the medicine on schedule, stay ahead of the pain. That means take your medicine on your prescribed schedule before that pain starts creeping in. Because once the pain creeps in, it's a little harder to get it at bay. But if you take that medicine, aka do this exercise before that pain starts creeping in, it's going to have a more profound and more lasting effect, okay? It's not just a one-time thing. That tends not to exist for most people in most conditions. It might, and if it happens, if you do it once and you're cured, hallelujah, more power to you. But in most cases, you're going to have to do this consistently for a couple of days to several weeks. But stay with it. If, as you do these extension exercises, you feel your pain get better, your symptoms improve, meaning they move out of the leg, and you move more freely afterwards, that's a good sign that this is right for you. Keep doing it, and your pain will go away. Make sure to subscribe to our YouTube channel, click the little bell so that you'll be notified each time we upload a new video. Share the video, like the video, and leave comments below. Let us know if you've tried this exercise for your low back pain or sciatica or both, and let us know how it worked for you. We'd love to hear from you.